And so how much have you received so far in the Fund and Grow program?
During the initial round of funding, I think I got $165,000 within 3 months, which was so crazy to me.
Hi, everyone. So today I am interviewing Marly, who is a client of Fund and Grow and who has an amazing company called Med Companion. So today we're going to learn about what Med Companion is. Let's start by first hearing a little bit about yourself, Marly, and what led you to launch this amazing company, Med Companion.
Well, thank you so much, Ari, for having me today. As you mentioned, I'm Marly. I am the CEO and founder of Med Companion. And prior to Med Companion, I spent about 15, 16 years working in the public health sector. So I worked for the largest medical scribe company where I received a lot of insight into the medical field from a physician standpoint, a clinician standpoint. And simultaneously, I got to experience the patient experience as well. I never really envisioned myself starting a company or being a business owner. But as life has it, in 2020, I lost my grandmother to breast cancer, and it was very quick. She went from having breast cancer to passing within 3 months. And in those 3 months, I witnessed firsthand how broken the medical system is when it comes to navigating your health and getting into appointments, getting your prescriptions, keeping track of something, especially someone who has such a chronic condition such as cancer. And one night I was just really upset and I was crying over my grandma not being here with me anymore. And I had just quit my job working for the medical scribe company. I was really burnt out. And I thought to myself, somebody should do something about this. Like, somebody should change this. And I had this crazy idea that I was somebody and I probably could. So that's really where the idea all started. It was the middle of the night, woke my husband up, and I was like, I have this idea. I'm going to fix this. I'm going to change this. And in the back of a water bill, I wrote my first business plan and got started.
That is awesome. And so to catch viewers up real quick, in one sentence, could you describe what Med Companion does so they can understand it?
Yeah, absolutely. So Med Companion is this amazing company that provides a human medical advocate virtually through our secure app. So it's like having a 24/7 medical advocate companion in your pocket at all times. So we attend appointments with you virtually. We meet with you to make sure that you understand your medical needs. We schedule all of your appointments. We make sure your doctors are communicating and aware of what's going on. So overall, we are your full turnkey medical assistant.
It's kind of sort of similar to what Fund and Grow does for our clients in a different industry with the banks. So that's very cool. But when you first started building Med Companion, what were some of the financial challenges that you ran into?
Yeah, that's a great question. So I think after that initial excitement wore off, where I was like, I'm going to start a business, I had this realization where I was like, okay, Marly, you have no money. And building an app, getting a software together, filing the trademarks, the more I started talking to people and the more I started making phone calls to lawyers and software engineers, I was like, oh, this is going to cost a lot of money. And I don't have that kind of money. So I started just researching ways that I can fund the business. And I was looking at loans that would come up and it just looked like really high interest rates. I'm like, well, I don't want to do that. I was looking at other ways to get funding that required like some sort of collateral, which I'm like, well, I'm not going to do that either. And ultimately, I think I came across Fund and Grow, and I started going down that rabbit hole, like, what is Fund and Grow? Is this really true? And I'll be very honest, it sounded too good to be true. And I kind of went back and forth. I'm like, should I do it? Is it a scam? Am I going to get the money? I don't know. And I went back and forth, and the more I thought about it, the more I kept coming back to it. And I ran it by my husband. He's like, yeah, I think it sounds great. He's like, you're right. It does sound too good to be true. And then I was talking with a friend. I'm like, I don't know. What do you think? Should I do it? And I just kept coming back to Fund&Grow. There was something about it that just kept bringing me back. And honestly, it was the best decision that I've made for my business, because without Fund&Grow, I would have never had the funding to bring my business to where it is now.
That's awesome. I just love hearing that. And so how much have you received so far in the Fund&Grow program?
Yeah, so in the Fund&Grow program, during the initial round of funding, I think I got $165,000 within 3 months, which was so crazy to me. And shortly after, a few months later, I ended up getting another $40,000 or $50,000 worth of funding. So just a little bit over $200,000. But to be honest, I did this about 3.5 years ago. And that same round of funding that I got initially is what has carried me through these last 3.5 years.
Oh, wow. So you're saying you have enough. You have enough to launch your business to get you to where you need to go.
Yes, I had enough to launch the business and to bring it to fruition, bring it to the public, and now getting ready for some Series A investment.
And going back to the beginning, what was it like the first few months after launching the business? What were some of the hurdles that you ran into?
Being a first-time entrepreneur, you realize that not everyone who says is going to help you actually helps you. A lot of them are just scams. A lot of them was like, yeah, I can get you the website. We paid someone to build a website, took my money, never saw the website. Then it was like a partnership, and it paid for the partnership, didn't work out. So it was just really getting savvy about who was going to deliver and who was just going to take my money. So thankfully, I had the funding. I had Fund&Grow, so it wasn't like detrimental, because I'm like, okay, well, I just lost that money, but I'll go make it back. And I still have all this other money that I can use. But ultimately, it was, once you have the money, it is very important to identify where your money is going to go. And as a new entrepreneur, it was designating priorities to where I wanted the money to go so that I can make my runway last a lot longer. That's
so interesting, because one of the things that we teach about is when you're using a business credit card, and of course that's what we're talking about. Fund&Grow does credit card stacking, helps businesses get access to credit cards. But when you're paying for a business website or any type of service using a credit card, you are actually able to charge back on so if you're working with a contractor, let's say you're a small business and you're working with a contractor, put it on the business credit card. Put it on the business credit card, because that way you can always call the bank and they will just reverse the transaction for you. So it's actually like business credit cards can be a layer of protection.
Yes.
In a situation like that.
Yeah.
I've actually had to do that a number of times with quite a few different scenarios. And it always sucks because you're dealing with a contractor that didn't stand up to their word. But you know what's great is that you get your money back.
Yes. And that was really helpful, because in that moment, I initially didn't know that you could do that. And when I talked to one of the representatives from Fund&Grow and they said that, I was like, wait, I can fight this. So I was able to recover a lot of that money back, which was nice.
Sometimes you make good partners, and sometimes the partnerships you make aren't what you thought they would be. And you, as a business owner, just have to kind of roll with the punches, move forward, and put on a good face for all of the other people in the company that you're working alongside. And it's kind of just par for the course in some cases. As we know, entrepreneurship is not always easy. Has there been any other situations like that? Any other tough decisions that you have had to make?
Yeah. So as you mentioned, not all partnerships are great, and not all of the things that you get for the business end up working out. So I've had to switch softwares early on. I've had to switch payroll companies. The first one that I had just didn't really do a good job with maintaining a the integrity of the payroll. So that was a whole situation that happened. And also, it's like you don't always make the right hires either, especially early on. So that's been something that I've had to learn. And as far as partnerships go, I had to let go of my COO last year. So letting someone go in a position that is that high can often hurt the business. And thankfully for us, as you mentioned, you have to just continue to smile, move forward, and elevate your team's morale. And we were able to basically take on that that void and rebuild it in a much stronger and better way for our customers.
And speaking of successes, because a lot of times you have to share your successes as well. Tell us a little bit about clients that have gone through your service and the benefits and the impact it's had on their life.
It's so nice for us to witness the impact that MedCompanion has. And sometimes when we're in the grind of the day-to-day, we forget to stop and celebrate those. But early on, we did run an 18-month beta program with about 50 patients. And in that program, we worked with patients who were undergoing cancer or recently diagnosed with cancer. But one of the stories early on came from a patient whose son, it was actually the son who contacted us, who was like, I feel really lost. I just got a phone call that my mom is fighting for her life in the emergency room because she has an alcohol addiction that nobody knew about. And she almost drank herself to death. And I'm told I need to find a rehab facility. I don't know where to start. I don't even know what I'm looking at or what I'm looking for. And at that time, we were running a few ads on Facebook. And he's like, I saw one of your ads and I felt like I needed to call. So I was like, yeah, thank you for calling. And as a result of that, within 3 hours, we were able to find a rehab facility that took her insurance, that was able to take her as soon as she was discharged from the emergency room. So there was no gaps in that transition. And we were able to get something that made the family feel comfortable with their decision to send their mom there. And she was there for 3 months. After the 3 months, the son was like, she's back to work. She's still sober. And I ran into this person a couple months ago, and it's now been 2 years since that incident. He was like, MedCompanion really saved my mom's life. Because of that quick transition, she is still sober today, and she's still working, and she is living her best life. So that was really powerful, because oftentimes when patients have to transition their care and there are delays in that care, it can create situations that puts them at risk to either relapse or make worse decisions than the first one. So the fact that we were able to work very quickly and handhold their situation throughout that process, and they just felt so relieved. It was one less stress they had to worry about. It was great, and the outcome was amazing.
I can just imagine that in a situation like that, the loved ones, many of them, they're not going to know what to do, where to turn, and even if they're like, okay, I need to go to a rehab facility, just going and Googling rehab facilities is not a great start. You really need a mentor or a guide that's going to help you and say, listen, with your insurance or with your situation or in your area, there's so many variables that that need to be considered in order to make a smart decision for our loved ones, that I can definitely see the value in having MedCompanion.
Yeah, and we handle all of that for you. So we verify that your insurance covers where you're going, whether it's to a specialty doctor, a rehab facility, whatever it is. We always verify to make sure your insurance covers. Or if they cover most of it, what does it cover? What are you responsible for? Those are things that patients need to be informed of. But also simultaneously, we do a lot of research. Like, we don't just send patients to random locations. We spend time researching the reviews. Like, do they have a good review? Do they have 4 or 5 stars? If they don't have 4 or 5 stars, why are the reviews negative? And that was something that we actually walked this particular individual through, because he was like, every rehab has a terrible review. And I was like, yeah, but are you reading the reviews? Most of the reviews are patients that left and are angry because the nurse didn't give them, the alcohol or the drugs. So like, that's kind of what you want. Like, yeah, the review is bad, but it's coming from an angry patient that didn't get, the drugs or the alcohol or the cigarette or whatever it was they were asking for. So that shows the facility is doing their work. So it brings a different perspective for individuals to look at the system differently as well.
Yeah, because I can imagine the gears in a lot of people's minds are turning. How do they take advantage of something like this? What is there a huge cost associated to getting access to your help? Is this something that's easy to get going with?
Yeah, it's very easy to get going with. We have put together a family plan. So for $2,500, it covers up to 4 people for the entire year. And that includes everything that I mentioned, from onboarding you, scheduling all of your appointments, managing your medication refills, education, support, attending your virtual appointments. And like I said, pretty much any medical need that you have, we can handle that. So $2,500 for the whole family. If you're like, it's just me, I'm the only person that needs it, we do have a $50 per month membership that allows us to handle your service. And very recently, as of last year, there are now Medicare reimbursement programs that allow us to partner with health systems and provide that clinical support outside of the doctor's office as well. So a lot of doctors are recognizing that their patients need all of that support outside of their office, outside of their clinic, navigating the system and alleviating some of the burden on the physicians and staff members too. So that is where Med Companion comes in. We currently work with an ophthalmology group in North Carolina, and we help their glaucoma patients, their diabetic retinopathy patients, and the results and outcomes that they're getting outside of just like those conditions, but as a result of having a team that is navigating the rest of their health, has been incredible.
Yeah, and I know that when a client comes in and we're applying for funding for them, the amount of funding that we get on the initial applications versus when the follow-up process happens, which is essentially what you're talking about here, is helping navigate the complex follow-up process. And it sounds like people can get started for like $50 a month, or if they have a family, it would be cheaper to go to $2,500 a year. But the $50 a month program for an individual, is it really easy to get started? Do I have to go and draw blood and everything, or?
So we wouldn't draw blood. What we do when we enroll you is we set up a call with you. The nice thing about our service too is that our goal is to really bring families together, because if your family member knows what is going on with your health, they will be able to support you better. So most of the time in the enrollment process, we have a son or daughter, or maybe like a son and their elderly parents, and we all jump on a group call very similar to this, through our software to keep everything protected. And we talk about like, what are you currently going through? What do you need help with? What are your concerns? Do you need to establish care anywhere? So we run through a list of questions to help us understand where your health currently is, what your concerns currently are, and what you're trying to get out of your health and your doctors during the upcoming year. And based on that, we can create a very aggressive plan to make sure that your care is moving very quickly, and not delaying any care in that process.
So you've put this really amazing system together, and it's a really needed service for people. But I'm wondering, in the future, over the next year or so, what do you see Med Companion doing?
So our goal, when we first started, we started initially providing the service directly to the consumer, because there weren't really a lot of programs supporting this need in the healthcare system space for doctors. Our goal is that in the next 5 years, we are able to partner with multiple health systems across the country that are able to leverage some of the reimbursement programs, so that these so that our services are fully covered at no expense to the patients. So that's ultimately what we're trying to work towards. And in that process, we are slowly transitioning more into a service that works on partnerships with clinicians, their staff members, their health systems, and their patients.
So you're working on high-level partnerships.
Correct.
And integration with perhaps from the carriers or insurance companies or from doctors' offices.
Correct.
And you already have some of those partnerships formed.
Yes, we do have some of those partnerships currently, and we also have several in the works. So my goal is that in the future, MedCompanion becomes the standard of care where anybody who goes to a doctor just gets a MedCompanion. Like, you have somebody by your side.
That almost sounds too good to be true. Yes. Because I've had to navigate working together with the insurance companies and healthcare providers and everything, and it's never been easy.
Yes. Our patients do enjoy the simplicity of it. Like, most of them is like, the peace of mind that we feel knowing that we're taken care of, and all I have to do is show up because my appointment was scheduled, my medications arrived on time, I received the wheelchair that I needed, I got the meal plan that my doctor requested, and I didn't have to pay for it. I didn't have to spend hours on the phone. Just provides a lot of peace of mind, especially for people like myself that have aging parents that now require more support, and I'm not always available to do it. I have my parents on a plan for MedCompanion. Like, their MedCompanion handles all their visits, and it makes it easy for me knowing that they're taken care of, their health's taken care of, and as a result, they're able to live a healthier life.
And that's awesome. I think this is something that, especially if you have loved ones that are needing care, that are in any type of situation like that, that it just seems like a no-brainer. But in many cases, people don't anticipate the type of care that's needed when someone gets into a situation, or when there's a problem, or when rehab is needed. And so you don't anticipate all these issues, like having a problem with the wheelchair showing up, and needing that companion that's already navigated those issues before. So sometimes you got to be in the mix and realize how hard it is before you're like, what, it would be easy. And that's what a lot of our clients at Fund&Grow have kind of gone through, that same situation. Then when they got that help, they also realized that it's not too good to be true. It actually can be done.
Yes, I could say I was one of those clients. I was like, Fund&Grow is too good to be true. Like, there's got to be a catch, but it really was just that good. Like, when I look back and I think about it, I'm like, listen, I partnered with Fund&Grow. I was able to go through their process. I was able to get all this money that probably would have taken me years. I probably would have given up, honestly. And I don't think my business would have been here now if it hadn't been for like that initial support and hand-holding and education and understanding of how to get credit, how to leverage credit, how to use credit as cash, which oftentimes you need because not everybody takes a credit card. And that was something that when I was struggling with that situation, Fund&Grow was like, oh, we can help you get the credit card so you can use it as cash. I'm like, oh, that's awesome. I didn't know that there was such a thing as that. And being able to leverage that and learn those things is like, wow, like that saved me a lot of time.
So for others that are walking their entrepreneurial journey, who have an idea that they also see as like, how do I penetrate into the market? It just seems so big, like kind of like what you've done. Do you have any advice for someone who has an idea and they just don't know how to take it to market? And, seeing you do it is very inspirational. So I imagine any advice you give is going to be powerful.
Yeah, I would say that one thing that I've learned is that you have to believe in yourself wholeheartedly first and foremost. And for me, I'm a very spiritual person, believing that God is in control and guiding my path has been very beneficial. But ultimately, there's going to be a lot of people that try to take you away from your dream. And that is where the believing yourself and your idea has to be greater than anything else. And if you have a great solution to a problem out there in the world and you can make it 10 times better than anything out there, then there's no way that you can fail. And lastly, something I always tell people, and I had a teacher that really inspired me. She made me believe I could do anything, including go to college, which was not in the books for me growing up. But one of the things she always told me was like, never let money be the reason you don't go after your dreams. So for entrepreneurs out there, I'm like, don't let money be the reason you do not go after your dreams, or you do not at least say you tried, because that's why Fund&Grow exists, because money should not be that issue. So I'm just very grateful that I took the leap, and I told people, I'm like, just take the leap. You'll learn as you go.
Yeah, I think that the believing in yourself and being crazy enough to say, I want to take my destiny into my own hands. I think that I can directly sell this to the market. I don't need to work for someone else to do this. I can do this, and I believe I can do it better.
Yeah.
And that's a little, you gotta be a little crazy to think that, to step out on your own. And, but once you have, it's really glorious, and it feels powerful, and you're able to help so many people. And that was one of the things that you said was, if you can find a way to help people. And so what you're doing is such a profound help to people that I think that it's just going to exponentially multiply and grow. And it's kind of sort of what we see at Fund&Grow. We're not helping people medically, we're helping their businesses, but it's the same sort of thing. You know, you have to be healthy in order to have a business dream.
Absolutely. And it's help in different ways. You know, help isn't always medically. Help can be in so many other things, like what you guys do at Fund&Grow. Like, you help so many people find funding in such an easy way that it allows for dreamers like myself to feel comfortable going after what we see, the vision that we've been given.
Yes, that's awesome. I love watching visions come to life, and especially ones like we work with a lot of real estate people and Amazon resellers, but what you've created is really, really remarkable, and it's unique. It's very different from a lot of the other companies that come to Fund&Grow. And the fact that we were able to help you with $200,000 so far in funding, you know, that's awesome. That's awesome, because we were able to help you, and you and your company are helping so many people. But if people are watching the video right now and they want to take advantage of Med Companion, where would they go right now to take advantage?
Yeah, right now they can go to www.medcompanion.com and find more information about us, book a free consultation call. A lot of people often, very similar to what you said, like, it sounds too good to be true. So they like to book a call and make sure this is really what they need. So we have a team of experts that are always happy to walk you through the process. Our nurses, our medical assistants, they're happy to answer questions and let you know how we can help.
Awesome. Well, I hope everyone goes and checks out Med Companion. And it's also been really wonderful taking the time today to have this conversation with you, Marley. Thank you.
Thank you, Ari. I really appreciate it. And thank you so much for what you do too.